When was the last time you really looked at your toenails, other than for a quick trim or polish? Most of us ignore them, but toenails can reveal a lot about our health. Changes in color, texture, or shape can be early warning signs of bigger issues. Today, we'll break down 8 toenail signs you shouldn't ignore and what they might mean for your health. No need for fancy tools, just your eyes and a little know-how. Let's get started. First up, yellow toenails. It might seem like a small cosmetic issue, but it's actually your body's way of waving a yellow warning flag. Our toenails can reveal a lot about our health, and a change in color is often the first sign that something's not quite right. A yellowish tint, especially if your nails are thick, brittle, or crumbly, often points to a fungal infection. Fungal infections are incredibly common, especially for people who spend a lot of time in closed shoes or damp environments. Fungi thrive in warm, damp shoes, breaking down the nail's keratin and causing yellowing, thickening, and even crumbling. If you notice your toenails changing texture or becoming more difficult to trim, it's time to pay attention. But fungal infections aren't the only cause. Sometimes yellow nails can signal nail psoriasis, an autoimmune condition that also causes thickening, pitting, and even separation of the nail from the nail bed. Nail psoriasis can be uncomfortable and may require specialized treatment. Rarely, yellow nail syndrome is linked to more serious health issues, like chronic respiratory problems or lymphedema, which is swelling caused by fluid buildup. If you notice yellowing along with swelling or breathing issues, it's important to get checked out. Prevention starts with good nail care. Keep your toenails trimmed straight across, not too short at the sides, to avoid painful ingrown nails. Use clean, sharp clippers and avoid sharing nail tools with others. Wash your feet daily and dry them thoroughly, especially between the toes where moisture can linger. This simple habit can make a big difference in preventing fungal growth. If you have sweaty feet or spend long hours in shoes, consider using an antifungal powder or spray. These products help keep your feet dry and create an environment where fungi can't thrive. Choose shoes made from breathable materials like mesh or leather, and rotate your pairs so each has time to air out. Avoid wearing the same shoes 2 days in a row if possible. In public showers, gyms, or swimming pools, always wear flip-flops or shower shoes. These simple barriers can protect your feet from picking up fungi and bacteria that thrive in communal wet areas. If yellowing persists despite your best efforts, don't hesitate to see a healthcare professional. A podiatrist or dermatologist can diagnose the cause and recommend the right treatment, whether it's medication or a change in your routine. Don't ignore persistent changes. Your toenails might be warning you of something more serious, like diabetes or immune system issues. Early detection can make all the difference. Good hygiene and smart footwear choices go a long way in keeping your feet healthy and your nails looking their best. Remember, a simple color change can be a clue to your overall health. Your toenails are like tiny health monitors. Don't overlook what they're trying to tell you. Stay alert to what your nails are telling you. Regular self-checks can help you catch problems before they become painful or difficult to treat. Early action can prevent bigger problems down the road, saving you discomfort and time. Don't wait for pain. Catch issues early, and you'll keep your feet happy and healthy. Your feet will thank you for the extra care and attention. Let's move on to the next sign and see what else your toenails might be trying to tell you. Have you ever noticed a dark stripe running down your toenail? This isn't just a random mark, it's called melanonychia, and it's something you shouldn't ignore. For many people, especially those with darker skin tones, these lines are usually harmless. Think of them like a freckle or a birthmark, but inside your nail. They can be a normal part of your body's pigmentation and often don't signal anything dangerous. However, if you suddenly notice a new dark line, or if an existing one starts to change in appearance, it could be a warning sign of subungual melanoma. This is a rare but aggressive form of skin cancer that develops under the nail. Key warning signs include a dark band that's wider than usual, borders that look blurry or uneven, or a stripe that seems to be getting darker or changing shape. Another red flag is pigment spreading from the nail onto the surrounding skin, what doctors call Hutchinson's sign. If you see this, or if the line is growing or changing over time, it's time to take action. Don't wait or try to self-diagnose. If you spot any of these changes, make an appointment with a doctor or dermatologist right away. Early evaluation can make all the difference. Early detection is absolutely crucial for successful treatment. The sooner a problem is found, the better your chances of a positive outcome. It's easy to assume a dark line is just a bruise from stubbing your toe or a fungal infection. But not all nail changes are harmless. Don't brush it off or hope it goes away on its own. Make it a habit to regularly check your toenails for any new or changing streaks. Catching changes early can be life-saving. Practicing good nail hygiene, like keeping your nails clean and trimmed, can help prevent trauma and reduce the risk of benign causes for nail changes. Even a quick weekly glance at your toenails during your morning routine can help you spot problems before they become serious. It's a simple habit that could truly save your life. Your nails are more than just decoration. They can be an early warning system for your health. Don't ignore what your nails are showing you. When in doubt, always get it checked out by a professional. It's better to be safe than sorry. Stay vigilant. Your nails can be a window to serious health issues. Let's keep going. Next up, what swelling toes could mean for your health. Swollen, red, and painful toes? It could be gout, an arthritis caused by uric acid crystals in the joint. Gout attacks are sudden and severe, often triggered by certain foods or alcohol. Chronic swelling might also mean poor circulation or venous insufficiency where blood pools in your feet. Lymphedema from blocked lymphatic drainage is another cause. For sudden, painful swelling, seek medical help. For chronic swelling, exercise, elevate your feet, and watch your salt intake. Manage gout by limiting high purine foods. Persistent swelling deserves a doctor's attention. It could signal heart, kidney, or vascular issues. Don't ignore swelling. Your toes are telling you something important. Take action early for better outcomes. Now let's talk about white toenails. Have you ever noticed mysterious white spots or patches on your toenails and wondered what they mean? You're not alone. Many people spot these changes and worry about their health. Most of the time, these white spots are nothing to worry about. They're usually caused by minor trauma, like accidentally bumping your toe on furniture or wearing shoes that are too tight and press against your nails. These harmless spots, known as leukonychia, will slowly grow out with your nail over several months, eventually disappearing as your nail is trimmed. However, if you notice horizontal white lines stretching across the nail, called Mace's lines, this could be a sign of something more serious, such as a systemic illness or even heavy metal poisoning. Another pattern to watch for is half-white, half-pink nails, known as Lindsay's nails. This appearance is often associated with chronic kidney disease and should not be ignored. If your toenails appear almost completely white, what doctors call Terry's nails, it may be linked to severe liver disease, congestive heart failure, or even diabetes. These changes are important warning signs. Sometimes, white spots or changes in your nails can be caused by nutritional deficiencies, especially if you're low in protein, zinc, or iron. Eating a balanced diet with plenty of these nutrients can help keep your nails healthy. If you only have a few isolated spots, it's probably nothing serious. But if you notice widespread whitening, a distinct pattern, or if the changes don't go away, it's a good idea to consult a doctor to rule out underlying health issues. Pay close attention to any patterns and look for other symptoms, such as fatigue, swelling in your feet, or changes in your overall health. These clues can help your doctor make a diagnosis. Remember, your nails can be early indicators of systemic problems. Don't ignore significant or persistent changes. They could be your body's way of signaling that something's wrong. Taking a moment to check your toenails regularly could help you catch a serious health issue early. Stay observant and proactive about your health. Up next, let's explore what it means if your toenails turn blue, and what you should do if you notice this unusual change. Blue or purple toenails mean your toes aren't getting enough oxygen. Cold weather can cause temporary blue nails. Just warm up and they'll return to normal. Persistent blue nails may signal circulation problems like peripheral artery disease, PAD, or Raynaud's phenomenon. PAD narrows arteries, restricting blood flow and raising heart attack or stroke risk. Raynaud's causes blood vessels to spasm, turning toes white, then blue, then red. Lung or heart conditions can also cause blue nails, often with other symptoms like shortness of breath. If blue color persists or is accompanied by pain or numbness, see a doctor. Regular exercise supports healthy circulation. Don't ignore blue nails. They're a warning sign. Your toes can reveal hidden health issues. Stay proactive. Next, the unmistakable itch. Itchy, red, flaky skin between your toes? That's likely athlete's foot, a common fungal infection. Fungi thrive in warm, damp places like locker rooms and showers. It starts between the toes, causing itching, burning, and peeling. If untreated, it can spread to the soles or toenails. Prevent it by keeping feet clean and dry, especially between the toes. Wear moisture-wicking socks and rotate shoes. Use antifungal creams if you get infected. Apply as directed even after symptoms disappear. Severe or persistent cases need a doctor's care. Early treatment stops it from spreading. Don't ignore the itch, act fast. Now let's talk about a serious red flag: ulcers. Foot ulcers, open sores that won't heal, are a major concern, especially for people with diabetes. Nerve damage and poor circulation make it easy to miss injuries and hard for wounds to heal. Untreated ulcers can lead to severe infections, even amputation. Daily foot checks are critical for anyone with diabetes or circulation problems. Ill-fitting shoes can also cause pressure ulcers. Never try to treat a foot ulcer on your own. Medical care is essential. Wounds need cleaning, dressing, and sometimes debridement. Managing blood sugar and improving circulation are key to healing. Offloading pressure with special shoes or braces may be needed. If you spot a non-healing sore, seek help immediately. It's a medical emergency. Don't wait. Early intervention saves limbs. Your feet need your attention. Let's finish with one last sign. Spoon-shaped nails, flat or curving upward, are called koilonychia. The most common cause, iron deficiency anemia. Iron is vital for making healthy red blood cells that carry oxygen. Anemia symptoms include fatigue, weakness, and pale skin. Spoon nails develop gradually and can affect fingers or toes. Iron deficiency can result from poor diet, absorption issues, or chronic blood loss. Don't self-treat with supplements. See a doctor for diagnosis and to find the cause. Treatment depends on the underlying issue. Watch for other anemia symptoms. Your nails can be the first clue. Your toenails reveal more than you think. Fungal infections, circulation issues, nutritional deficiencies, and more. Don't panic, but do pay attention. A weekly check is a simple, free health screening tool. If you notice changes, color, shape, pain, or swelling, see a doctor. Early action